Good evening, viewers. Ladies and gentlemen, this is Dr. Natish from Lifeline Hospital with yet another edition of the COVID-19 Impact Program, and which is now associated with H Digital from the US. And we have our US partners as well with us. And today we have a very, very wide array of panelists for you to enjoy the show. And, they will come from various and diverse fields from this side of the ocean to the US side as well. And let me start introducing our panelists one by one. So I have Dr. Ravi Kumar with me. Can I have the spotlight, Amit, on Dr. Ravi Kumar? Yeah, that's Dr. Ravi Kumar, a very, very well-known interventional radiologist. As many of you know, radiology is all about imaging and medical sciences. But what many of you may not know is Ravi is a very well-known interventional radiologist. That is, he does procedures inside small vessels in the liver and other organs, blood vessels, where, for instance, he can literally prevent a surgery from happening. He can take over and do things in the small arteries by inserting what we call small metal stents, and that could prevent surgery. It could, lead to a situation where a surgical procedure is not required. So that is interventional radiology, and Ravi is one of the most well-known interventional radiologists of the country. Welcome, Ravi, to the show.
Thank you.
Questions as you like. With that, I will start with Dr. Dr. Ravi. Can I have him on the spotlight? Yeah. Ravi, you're a medical doctor, of course, and can you give us an overall view, briefly, about the pandemic from the medical perspective? What happened and what's happening and what's going to happen?
It is to start off. Hi, everyone, and the whole thing is the immediate thing which comes to my mind.
Ravi, I'm sorry to interrupt. Can you just bring down your screen a bit, because only the head is seen. Konjo kila. Just a bit down. Yeah, that's okay. That's good.
I think it is going back. Okay, anyway.
Okay. Fine.
So,
all right.
The one thing which immediately strikes me the moment Natesh put the question was, that this virus is a 125 micron meter diameter virus, and that has crippling 185 odd countries, and that's devastating. So just immediately came to your mind saying that such a small virus can create so much of havoc among the human being. But one thing which we all fail to do from the medical side and as well as from the other people is, there were very clear-cut forewarnings years before, because the same family of this COVID-19, there was in 2002, 2004, if you see, it came as SARS-CoV-1. And then it just created a little bit of havoc, a trembling. It was like an earthquake which is going to come in future, but we failed to understand that. And then similarly in 2012, 7 years after, there was something, the Middle East respiratory syndrome, caused by the same family of virus. So now in 2019, but all these things happened very small way. It was creating some kind of havoc and left, and it gets jolted us. But then we just never forgot. We forgot to think that this is giving us a good amount of warning. But now in 2019, the same family of virus, which is much more virulent, 1,000 times virulent than what happened, has happened. And now we're facing the brunt. And the truth is, in future, things can happen, and it may happen also. So we have to be mentally prepared, because we've never seen a kind of pandemic as what has happened now. So that's why many people do not understand the severity of the situation. That's why many people do not see how it is going on. So having given you a brief history of it, let us go to the little bit of facts now, what is happening around, and how, as a normal layman, what you need to know. The whole thing is, it spreads by transmission through viral transmission through droplets. So it affects the ear, nose, throat, and then it goes to the lungs. So that's why we keep saying, do not touch your face unnecessarily. Do not meddle around with anybody else's face as well as your face. Meddle only when necessary, number one. Number two is the symptoms. Like one, we can see like what, if it affects a person, what happens, and what happens to asymptomatic people. So I think this kind of a knowledge will be much more better, I thought. So if one is affected, you can have fever, you can have dry cough, You can have unusual tiredness, sore throat, loss of taste and loss of smell. Loss of taste and smell happens more in the Indian continent. We have seen like 35% of the people reporting loss of taste and smell. So if you have this, that means you may have COVID-19. Not definitely you should have COVID-19. If you have this, and please go to your doctor and see whether it needs to be tested or not. Do not get panicky at all, because the good thing about this is if you're infected with this, it is not that it's the end of the day. It is just that you've succumbed to a viral infection, which 90% of the times you're going to come out of it normally. A 5 to 8% of the time, you may have a little bit of breathlessness going to the next stage, but you'll again recover. At least 2% of the time. That can happen even when you walk on the road, somebody can hit and you can still live. At the same time, you can die. So, but it's created a lot of panicky situation everywhere throughout the world because of the media, of the way of all the, how the, what you call the social media interaction has highlighted this whole thing.
Sure.
One way it's good, but the other way it's a little bit, it's mentally troubling us.
Sure.
And how do you prevent it? See, that one thing is social distancing is absolutely necessary. You have to follow the rules of social distancing, and you have to have a very clear-cut mask. Mask, make sure that you wear covering your nose and mouth and go right up to down so that it doesn't leave any space. And the types of, I'm not going to discuss if there's any question from the public on what type of mask and things, then we can answer.
Yeah, we got a lot of questions for you. So
the best way is to prevent it. So once you prevent it, I'm sure that you can really be successful over this acute crisis of pandemic and get over all this in a short.
You run, Spotlight Ravi, we know that you run behind you GTS Center for Wellness. Yeah, I've been doing it for about 10 years, I know. So tell us basically how is wellness important basically, Ravi? And especially in times of this stressful periods, do you think having a very structured wellness program is good for everyone?
It's a very nicely put question, because the concept of wellness is very poorly understood in the current world, because wellness is totally taken over by all the spas and other kind of way how it is going, because we don't have an outcome-based wellness program. The basically thing is, as a wellness doctor, as a doctor, we need to understand when a patient comes to you, when a person comes to you, what is that which is lacking, what is that needs to be offered, so that we can create a personalized wellness program for them. So in this kind of pandemic situation, of what I commonly come across now in my clinic is the fear factor, the emotional factor, the mental status. Will I get COVID? Am I going to be susceptible? Will I going to lose my life? See, like for that kind of a thing, there are no medicines for it. As likely Brinda said, like we need to adopt some other program for them. So if we can identify what is your stress level, what is your wellness level, and create a score, and you create a program, customize a program, and see whether the score improves, that becomes wellness. So if I can offer a mental wellness program, I can offer a lung wellness program, I can offer liver wellness, a cardiac wellness. There's so many kind of wellness programs can be offered and can be designed for that particular person. So we are creating an outcome-based wellness program for these kind of patients.
Wonderful, Ravi. Wonderful. And as you know, there's a lot of isolation happening all over the world, right? And more so in Chennai, especially where we are. Home quarantine, they say the lockdown is going to extend again. So isolation brings in stress because it's a different atmosphere. People feel claustrophobic. How do you think wellness helps in that? What do you think we should do to overcome that?
Yeah. See now, because till now, there had been no restrictions for us. So we were going anywhere when we wanted, we were roaming around, we were meeting friends, we were just having a gala time everywhere till now. But now there's a situation which has come up. We are not mentally prepared for this kind of a forced kind of any scenario. At least in India is slightly better. People are somewhat listening, but there are countries where people do not. I mean, they're finding it very difficult to get accustomed to these kind of thoughts. the first thing what we need to think is, yes, now why it has happened. Now, this is basically said for ourselves. So I mean, in this stressful kind of a situation, that itself creates a lot of stress for the people. So something which is going to control them. I don't want to get controlled. I cannot stay in this place. I cannot stay in this room for more than half an hour because we're not used to it. So now it is those kind of people are the maximum people who come to my clinic for saying, like, these are the problems which I have. And we have a teleconsultation too. So then we identify what is the nature of the particular individual. You know, like the nature becomes very important. So because there are like different type of personalities, like how we call it in ourselves. Like, so we need to have the personality, or what we call it in Ayurveda, the prakriti type. So what is the nature of the particular person? So then we go intensify it, asking a few questions. And in this, then what I come across now is the lockdown, giving restrictions for them, saying that from 8 to 2 you can go out for the rest of the time. So people get really panic. I can see people staying in the stores from morning 6 o'clock, where it's going to open only at 8 o'clock. So they don't want to miss it. That is a fear factor. Anxiety. These are things which are coming up. So we just need to make them understand why it is happening and what is that we need to do. So mental strength is one thing which I find is very, very important. And a combination of factors can address this issue and make them much better.
Wonderful, Ravi. Thank you. Briefly explain what is HBOT and how it really helps not only for COVID positive patients, but also generally for all diseases.
Perfect. I mean, HBOT is, but it's called as hyperbaric oxygen therapy. It's HBOT. In short, we call it as HBOT. So just to give you a small thing, like normally in the normal atmosphere, we have 21% of oxygen. And with that, our entire life is going through. And with so much amount of pollution and which whole thing, that 21% of oxygen is reduced, but still our lives are keeping on. What happens in hyperbaric oxygen therapy is, it's slightly different from the routine hospitals where we keep the masks right in front of us. It doesn't give you 100% oxygen at all. It just gives you, we just adjust to 4 liters, 6 liters, and you just try to inhale whatever it is. But the whole concept of hyperbaric oxygen therapy came because all these things are not able to infuse the real 100% oxygen. So they came out to the whole system saying that if you increase the pressure in a chamber and we put a person inside, I mean, I'm not going to bore you with the laws, but there's a Henry's law. When the pressure is increased, then you forcefully perfuse oxygen into the tissue, and thereby it perfuses the entire body right from head to the tip of your toe with oxygen. And nothing can give you 100%, but gives you 99% oxygen. So some of the things where it can be really of help is areas where circulation is bad. For instance, in diabetic patients, the diabetic foot becomes a problem because there's no circulation and we go into doing amputations. It's a wonderful system for those kind of people where, because in normal breath, you need hemoglobin to take care. But in hyperbaric oxygen chamber, you don't need hemoglobin to take care. Wherever there is plasma is everywhere. So the oxygen diffuses, gets it out into the tissues, thereby reperfusing the tissues. For stroke, the moment a person comes to stroke, some of the hospitals in the US have got a hyperbaric oxygen ambulance. They put the patient into the ambulance and they shift the patient for therapy. So that's the kind of oxygen chamber what we need to do. There are a lot of these hanky-panky oxygen chambers where they give that, they have a whole lot of only focused hyperbaric oxygen chamber. Doesn't work at all. Oxygen needs to be carried out through the lungs. It has to be perfused. You have to be in the chamber, and that is how you have to make sure. This is what hyperbaric oxygen chamber is all about.
Wonderful, Ravi. Wonderful. Thank you so much for that.